What's up, bro?
Yeah.
Aloha, aloha, aloha.
Hey man, how's everybody doing?
Got my I just don't have all my setup here, so here we go. Okay, okay. So I'm gonna have to makeshift this fella somehow.
Yeah.
I really don't know how I'm gonna do this, but I'll manage. I'll manage. Wait, video interrupted. What's going on? Oh, oh, there we are. Wait, live video interrupted. What's going on? Are you
Well, I
getting
see.
that?
I'm seeing. Yeah, I'm seeing.
You get the live interrupted?
No.
Okay, must be just my phone. It's my phone because over here
Yeah,
they
you
get
got.
5G. Anyway,
Yeah, it's going. It's going good over here.
okay, good, good, good. Main thing is working outside. Main thing we got the connection going here, and
Yep.
I just gotta find some place for put up my phone because I'm not in my room. Anyway, what's up, everybody? Can you hear me okay, Charlie?
I hear you good.
Okay, good, 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 good. All right, let me get this thing all squared away. Awesome, awesome. Yes, Uncle Charlie, you did a great job today at the press conference. I just saw Melissa post that in there. You did a hell of a job. Hell of a job.
Thank you.
Appreciate you holding them up, brother.
Oh, I do want to say thank you too for the invite and missed you, bro. I think would have had a bigger impact if you were there.
I don't know
But
if it'd have a bigger, it'd be a louder impact, but
yeah,
but you did a great
uh,
job. And I think what you said was, I hope people understood what you said. I know our viewers did, but the general public that's going to see it, they know your heart, Charlie. They know your heart. We know your journey. We know your heart. So for all of us that saw you at the press conference, it was just we already know your heart. I just hope that the others can understand and appreciate what you said today.
well, I have to say thank you to the mayor and Sarah Blaine for the invite. I would have never known, but they ask, they want to get all facets, and I have to agree with the mayor. He brought Pastor Matt. I forgot this other gentleman's name, another pastor, and they
John,
brought
Pastor John.
yeah, and they brought uh, Rob from Rob's Good Time Grill, brought him on, and chef for Mark's Place. So it was, and Dr. Capona Chong Hansen, of course, and many others. Mark Ozaki with KPD, and our good friend Pablo, battalion chief from KFD. So it was, to me, I think it was a well-rounded group, and everyone had something important. It was equally important all the way around. So I'm just glad that I got to take part. But wish you were there, my brother. But I know you're happy to be with your lovely daughter. And how's she doing? How's
Oh,
she doing so far?
she's doing good.
Yeah.
It's almost 2 years since we saw the kids, and it was just unfortunate that because of COVID, forced us to come up. You guys all know my position on flying. It was just a rough time. Patsy came up while Nikki was sick, and took care of her, brought her back to health, and I came up. She's actually getting her vaccine this week, and we want to just be here for that. And but she's doing good. Thanks, Charlie. Thank you guys again for all
Good.
the prayers and the well wishes. And uh, it's nice. It's just nice being here, and not much we can do really while we're here, but uh, it was cool. It's cool to be
Yeah.
here. And in fact, she's in her bed, and it's 10 o'clock here. But yeah, we're glad to be here. Heading back home probably early next week once we know that she got her shot and there's no reaction to the shot.
Well, just want to let you know that new rules will go into effect tomorrow. I don't know if you heard, but when you come back to Kauai, you got to take 12 pre-tests and 14 post-tests.
That's what I heard. That's what I heard. How was the how was the flight and the airports? Somebody's asking how was the flight and the airports? Hey Wally, mahalo Wally. Yeah, it was great. It was great. The airports. I went early. I left early in the morning. Honolulu was actually it was well controlled over there. I didn't see too much. Of course, in the morning you don't get the 3 or 4 direct mainland flights. So Lihue Airport was great. Honolulu was. I'm sorry. I flew out of Maui. I flew out of Maui because the flights out of Honolulu to Portland, direct to Portland, never had too many open area seats. So the one from Maui had plenty open seats. So, but I will say that at the airports at Lihue and at the airports at Maui, everybody wears their mask. It wasn't a social distancing issue the time I flew. At the times that I flew, there were no social distancing issue. As far as the aircraft itself, very little movement. Everybody sits in the seat, masked up, double masks. I had a double mask. I had a 95. I had a shield. I disinfected. I wish I had my wipes over here. I'll show you. But I disinfected that Clorox wipes, that one that comes in the little bag with the pull top. That leaves a lot of. It leaves everything wet. Yeah, mine is the yellow one, but it's just these types here. We got them all over the place. I think we're so paranoid, you know. But it leaves everything wet. So it's just like you don't like touch them because it's wet. So I just never move. I just never move, and neither did I. There's not much movement on the plane, so we'll see what happens. Somebody just said I'm the guinea pig. Yeah, we'll see what happens, man. It's again and I'll be criticized for flying because I'm the advocate against flying unnecessarily. In this case,
let me stop you right there. People can criticize you. There's a difference between traveling for leisure. This wasn't a leisure travel. Let's get that straight, folks. If you had your child someplace and they suffered from COVID, tell me you're not going to fly. We understand. What we're saying is when people just travel just to go travel for no reason other to take on vacation, I mean, I gotta say for the most part, people coming to Kauai, they're taking a precaution. But if you know what I know, since I work down at Don Airport every day and a good airport, I gotta say the state has done a good job. There is so many flights coming in now from all different angles. And I wanna give a shout out to my crew because they're there to sometimes stop people from mixing in with the inter-island. Because we get that sometimes. Then you wonder how they slip through the cracks. Because there's so many bodies moving. But we got people that have done this day in and day out, and they're doing a good job. And I think everybody should be commended, even our frontline workers. Many of them want to be home with their family, but they know that there's a job that needs to be done. So I want to thank them. I want to thank them very, very much.
Yeah, they made it less. Shout out to Kaleo Perez, who was my personal guide to the gates, and
I don't beef with that guy, Because of him, I took this job.
Yeah, he's a good guy, man, all around good guy, and even Starbucks. When I went to Starbucks that morning, I wasn't going to go inside, but when I looked from the door and I saw they had the markings on the floor, everybody's 6 feet, and they had everything under control. So, as best as can be. One thing I will say, Oregon was known for the carefree lifestyle, and in fact, they didn't have a mask mandate for a long time. And then when everything, the surge started going across the country, Oregon wasn't spared. So the governor reinstated the mask mandate. And I will tell you, my wife will attest that everywhere we went, everywhere we drive, because, we drove around a little bit today, everyone has a mask. Everyone's wearing their masks. I think everybody's scared. I think everybody has realized now that this stuff is real, that people are dying. and people better be safe. Yeah, that's the message I got from the mayor today. One of the things differently I noticed from Mayor Kawakami, he came out today and he's giving people an option, right? He's giving, trust me, what you guys heard today, if you heard it, it wasn't a press conference. I know someone asked about a press conference. It was basically a PSA. It was a video PSA. And he used the community leaders from all over Kauai. But basically, what he said was, we don't want to go into a lockdown, but if we don't do what we need to do, we will. So, and he's letting the people know that the lockdown is coming if we don't shape up. We cannot avoid one lockdown. By the way, guys, if you guys are wondering, I know a lot of you already know this, but tonight we have Dr. Miscovich on the show tonight, and he'll be on in a couple of minutes. But really, Charlie, that's the warning. That's the final warning, I think, from our county on Kauai, that if we don't start behaving and we start being careless, we will see a lockdown. That's the only thing else we have that the county locally can do.
Well, I will tell you this, and you heard that speech, but I'm very passionate about one thing. If I cannot convince you already, then fine. I'll just have to accept that. But I don't want to hear anybody crying because we're on lockdown. We're being given fair warning, including me. Okay? So if you folks think that you're going to have that leisureness of just going wherever you want to go, it's not going to happen. It's not going to happen. And I've seen some, I've been seeing some movement of our National Guard now on the streets. So I know they're like Kauai, with the exception of the Pacific Missile Range. There's no area that they have a lot of practice deployment. So I know something is getting ready. But again, the mayor made it perfectly clear. We can turn things around, but we just gotta buckle down. That's all. And the thing I appreciate about it, he never scold nobody. There's a way of saying it and there's a way of scolding people. And I think the more you scold somebody, the more resistant they become, right? So he just laid it out there and said, just try our best. And but I do want to also give a shout out. I see Tiffany writes that there's a really good sergeant at Old Triple C just got put on life support. You folks did not know, we as a first time again, we're thinking we're probably going to bring on our sister Lana Hughes, who recovered. She was one of the first COVID guards, the first go around. And you would have thought OCCC would have learned the first time, making the same mistake from what we understand, and it's breaking out again. So sad. And even though they were convicted or they're awaiting trial or whatever the case may be, they committed a crime. They're gonna have to answer for their crime. But in the meantime, they are still human beings, and they are sitting ducks. When you take someone who is infected and mix them in a module, especially when the module is overcrowded by 5-fold, and the others are not infected, guess what? They're going to get infected. There's no way around it. And that's what's happening right now.
Yeah. Yeah, Wally Nishimura. I wish the governor would just take a stand and test everyone coming in. Wally, for the life of me, and I don't give a damn what side of the issue you're on, right? I really don't care. We test everybody coming in. We pre-test, post-test. It'll make a bigger dent than what we have now. No doubt about it. We've done it before. Once we lifted this, once we re-entered this unsafe travel program on Kauai, and we did it twice. Remember in the beginning, when we were requiring the quarantine and all of that. Our numbers were 0, 0, 1, 2 here. And then we opted in and the numbers went through the roof. So we know that, and I just, for the life, I listen to, I hate, this is what's the problem, Charlie, with this issue here. We get plenty of friends, right? We all do. We get friends on the visit industry side. We get friends on the law enforcement side. We get friends on DPS side. We get friends all over. And when you hear people come out and continuously say it's not the visitors, it's not, first of all, we're not talking, even Wally, his comment there didn't say visitor, it said travelers. But when people come out, especially the industry people come out and say, it's not the visitors, you cannot make that statement. That's not a true statement. It's both, it's all, it's travelers. So it is what it is, guys. Wally's on target. Test everybody. The governor needs to do it. Not leave each mayor to come up with their own programs. It should be the governor should come up with a statewide mandate. How? He's not running for office, at least that I know of. You don't have to worry about the political damage. This is not a political issue. It's a health issue. Anyway.
Yeah, that's true. That's true.
Here we go. Dr. Miscovich in the house. Ding. Ding dong. Yeah, exactly, Mireille. When they say it's not the visitors, it's like saying the spread is not happening in schools. Excuse me. What are you talking about? COVID doesn't give a damn who you are, what you do for a living, where you are, how old, what color, it doesn't matter. So the discussion shouldn't really be about tourists versus local residents. No, it's just travel. Anyway, what's up, Dr. Miscovich, you world-renowned popular dude? God, I mean, you're a celebrity, man. You're a celebrity.
Well, I'm not looking for celebrity status. I'm just looking to help the planet and help the country and help people. And that's why I pulled back here to Hawaii. I was on the road. I have a lot going on there. And, I just can't leave just as I'm watching all of these things happen that we know are just headed in the wrong direction. And we're not really doing anything to address it right now. Very worried.
Well, I think when I went to taking my college classes in management, they talked about the lackadaisical. They had another term for that, for leadership that would just kind of relax and let things fall into place. I think that's kind of what we got. And they allow themselves to be put in a corner where then they have no choice. They have no tough decision to make because it's the only decision to make. And I believe that's the path that our leadership has taken. You know what? Let's just let it get to the point where we have no choice. So then we have no choice. It's so much easier to come up and say, we have no choice, rather than try to stop that day from coming. And I think it's a bad route to take. I really believe it's a bad route. And as a result, what do you see? Today you read that the morgues now, the mobile morgues are actually in service. They're using those refrigerated containers, according to the hospital, or I'm sorry, the Department of Health, that they've actually started using the mobile morgues. See, not only COVID people die, right? Everybody, we have a lot of deaths just that needs to be addressed, and it doesn't help when you have this many people sick.
Well, you talked about management leadership style, and you can get all the business training. But see, we're in a very different situation. This is a pandemic. This is a pandemic unlike the modern world has never seen. And the decision-making leads to death. Okay, so this is not a business decision. This is a decision that leads to the death of the people who depend on the leaders that we've elected. And so that type of, as you say, laissez-faire or apathy and just letting things fall doesn't make sense to me when as we saw, 8 deaths. We were already informed today that there are already more people have died today that will be in tomorrow's listings. And we already can tell that more people will die. And every day that we have these counts that are in the 800s, we can calculate out, predict that even at bare minimum, 1% is our fatality rate. And the thing is, we could stop it. You know what? It's preventable. There's certain things that happen that are unpreventable, right? It doesn't matter what you do, you can't stop it. But this is preventable. So I'm really, frustrated, and I talk to Harry 2 or 3 times a day, and he's frustrated. And I talk to all types of other leaders. I think you have a great guy coming on tomorrow with Tim, and there's a small circle of people who I really believe are experts. And we're just like throwing our hands up and saying, how can this be happening? How can we be watching this happening when we all know where it's going, how to fix it? Because it's not like we don't know how to fix this. We know how to fix it, right?
Exactly. Hey, Marie, I just saw your comment. I don't know what I said or what, but that whatever comment I made was not meant for you. So I don't know what I meant. Visitors are not wearing masks. Yeah, I mean, I think that goes without saying. We know the problems, but yeah, I'm apologize if I don't even remember what I said, but it was not directed to any comment that you made. I didn't see it, to be honest. Sorry about that.
Yeah.
Charles, you look
Concerned.
yeah, concerned.
Well, I woke up this morning at 2 a.m. I drove out because I was tasked, as you know, and I disinfected buses today because they were contaminated from infected children. Why is that? These are confirmed cases. There's nobody else there with me. It's just lonesome old me going in those big buses and just doing what I can to disinfect that bus, every seat, top and bottom. But the thought of it is children are getting sick. Now, you've got a child that I shouldn't say sick, infected, because they may not show symptoms, right? How do you use that rule when they're sitting in a bus? So I was told how the rule last. I said, yeah, but because there's no back windows, guess what happens if all the side windows are open? Guess who gets it the most if this is truly airborne transmission, right? The poor kid that sits way in the back, because that's where it concentrates the most. And that's where I paid the most attention to, way in the back. So, it's just stuff like that. And then, because I enjoy what I do, but I get to see certain things that come through our airports. I get to see how hard people are working to screen these people. And you know what I can't get? Hawaii is all over the map, and they tell you what you need to do to come into this state. And yet people still come here. Oh, no, I didn't know that. Oh, I didn't know this. Then it's people like my staff and we the bad guys, because we got to take them and go get them isolated or go back where you came from. Do you think we want to do that? But people that don't pay attention to what they're doing to come to our state, they're the ones that's pushing the buttons, not us. And you know what is what's even more sad? And as you can tell, there's a lot of privacy issues, so I won't isolate. I'll just say it generally. It's sad when the information does not upload, right? And so when they land, they got to quarantine, right? That's what it says. But then the information comes through, ping, and guess what? Right at that point, those poor screeners and the poor people that got to work those areas can look down and they'll see something like positive and the type of test they took. in AAT. So what does that mean? That means the person was on a plane. He was positive. Now you just had a plane come over with 200 some odd people. What happens now? Do you get all 200 and you quarantine them? Because 199 of them all got cleared. All got cleared. Just that one person. Now what happens to that 199? Because their test might read that they're negative, right? When they took the test 72 hours prior to departure. So that's why we always said, you got to be careful. That's why we wanted that second test to test thereafter.
Yeah, well, just for everyone's information on Kauai anyway, for the county employees that travel, when they come back to Kauai, they cannot go back to work. I don't care if they're vaccinated or not. They have to take a post-arrival test on the third day, and it has to be negative, or you don't go back to work, and you don't get paid. Use your own leave. So if you want to go travel on Kauai, our county doing what they can do, you will be required to take a post-travel test before getting back to work. It has to be negative. So I applaud our county for doing that. It's your choice to travel. It's your choice. But Doc, this is the deal, right? We got record numbers every day. Every day we're breaking yesterday's numbers. We got no testing, vaccination exemptions. We got the personal, I shouldn't say personal, but you got the local rules that say you cannot have gatherings in your house more than 10, 25 outside. You have business establishments that are now limited to 50% of the occupancy. You have luau's and all these events that are still allowed to happen. Let's just say for right now, you were appointed, and I'm not going to say governor. I'm going to say you are tasked with the plan for the next 2 weeks or 30 days to get us out of this very dangerous position that we're in, involving testing or whatever. What would your plan be, or what would you be looking at and considering to get us the hell out of this danger zone?
I'm going to give you two answers, okay? And you'll see why I want to give you two answers. But the direct answer is I've already made my position known, and I'm going to put a little bit of a supplement on it to explain it. I would shut down. I would go back to a stay-at-home, work-at-home order, okay? And I would set it for actually 4 weeks, because that's the science of the disease. And essentially, let me explain something that I'm not hearing our leaders talking about right now. What we're doing right now is we're kind of on this wishing, well, maybe there'll be a plateau, or maybe our numbers will go down, or maybe something will happen. Well, I mean, we all know, and you're going to hear it in detail from Dr. Brown tomorrow, that we're going to exceed that 500 line in the sand that the Lieutenant Governor gave today, and our hospitals are going to be maxed out, and the capacities are going to be just pushed to the limit. It's going to happen. It's like at this stage, we've passed that line. And how can I be so confident? Well, look at the number of positives today. Look at the hospitalizations. Look at the line of the hospitalizations. You're going to hear that ad nauseum from people who are experts. We saw what the pandemic planning group put together. Did anybody listen to it? These are our government's own people in our only main university, and they put together this warning, which is based totally on science and fact with the whole group. No comments. No one's ever looked. So here's what I want the people to understand. Yes, it's hard, but think of where we are right now. We are coming down to the beginning of a slight slump after the Labor Day holiday. And then we have that decline that goes into October. And then we build up into our first big push, which is Thanksgiving on into Christmas, into our real holiday season. Now, think about this. If we can close down for 1 month, all of us will guarantee, and that's a guarantee, how many doctors guarantee you anything, will drop 75%, right? We put the systems into place to do very effective testing. We put systems into place dealing with more vaccines. Perhaps, as they said now, vaccines may be going into restaurants or facilities. We teach the restaurants perhaps how to set up outdoor activities. Let's take that month where, like, there are cities that are blocking off the front parking stalls in front of the restaurants and allowing them with new ordinance to go ahead and set up outdoor activities. We've never even considered that. We should be doing that to help the restaurants and the pubs or people that need to be surviving, right? And get our kids masks to be in school, because we should shut the schools down, teach the teachers, put the testing programs into the schools. There's so much that could be done in 1 month. Now think about it. You're a tourist. Right now, you had the governor go on TV and say, don't come here because we have a lot of COVID. Well, let's fast forward now 6 weeks from now, or let's look at people who are making their holiday travel plans. It's going to keep transitioning over. But on the other hand, if you want to have something that tells the people of America and the world that we care about our people and we care about their safety and we want them to have a safe vacation, shut it down now, fix it now, quickly, expeditiously, so that when we turn it back on, that you rearrange safe travel, pre-travel tests, post-arrival tests, all the things that we've talked about. And guess what? We're going to not go through this protracted decline like everybody's warning. Oh, we can't shut down again. We're going to be booming again because people are going to say, wow, way to go, Hawaii. You got your shit together and you made it the safest place in the planet for us to come. Sure, I'm going to go to Hawaii because, guys, mark my word, the rest of the planet, no one's going to want to travel to because it's not going to be safe. So where's, what do you guys think about that? I mean, I haven't heard this played out in a logical sense, thinking about all the aspects of both, first for me, it's the safety of our population, but yet compassion for businesses. But I think our leadership is driving us down a path right now to crush us and to crush our businesses, because we are being forced into bad publicity, a protracted shutdown because of how decimated the hospitals will be and how our numbers are going to keep on surging, because the numbers we already know are going to go on 4 to 6 weeks beyond of what we're at. We're already committed into October unless we do something immediately. So what can you guys tell me? Am I crazy?
Well, I'll tell you one thing, because everything that you said, Doc, and I listened to you, I think of it this way. It leaves me with only two options. Option one, we shut down. And that's going to create a disaster. Option two is a two-test process that we've done before. Kauai got the data to show it, right? Because right now, other than that, I mean, correct me if I'm wrong, everything that I hear that's coming out of the administration leads me to believe we are totally saturated with this variant.
Yeah, it's everywhere. It's everywhere. And again, what I'm looking at is save our hospitals, save our population, save lives. As a doctor, that's always going to be my first decision. Always going to be my first decision. And we now have lives that we're losing every day because of these decisions, right? And yet, on the other hand, we, all have friends and family who rely on us staying, prosperous and open and things like that, and working, et cetera. And I just think that, if you want to flip, everybody's making decisions on the tourist industry. I think what we're doing right now. And that announcement that got spread all over the world was very bad, very bad publicity for the state of Hawaii. And it didn't do anything. Like, people are going to go, oh yeah, okay, I'll cancel. Well, if anything, what's going to do is, the more it gets publicized, I think the more it's going to turn people away as Hawaii being a COVID hellhole. Because how does news work? You get bad news. You know how long it takes to improve bad news, right? You can do 100 good things after you do one bad thing. We all know that from growing up, right? When your parents always reminded you of that one bad thing, you could do 100 good things, and they still remind you the bad thing you did 10 years ago, right? Blunder. It's a blunder, but more a blunder because we're going to lose lives. Now, flip it over. What has to be happening in the meantime? How do you deal with this? If I had decision making to do right now, and they took like, nope, we're not shutting down, no shutting down, so you're going to have to fix this without shutting down. Number one, we have to do massive surge testing. And so when I'm talking about that, like, you guys on Kauai would have about 4 locations. So, and you guys are better off than most people because you've had some pretty positive things going on, but you would have access 7 days a week, and you would do it for hours that would deal with working people and daytime people, and you would put it way out towards the base, and you go the whole ways up to the North Shore, and you would have access unlimited that people would come into. It would be free. And then that would be, and then Oahu, you would put 3 down the windward side. You would have it throughout downtown. You would have 3 out on the Waianae coast, which is decimated, Wahiwa, nonstop. You don't need that many people to staff them if you have that many places. Each island, you would do the same thing. 7 days a week, available public knowledge, and you would say, please, go get tested. If you were first degree contact, second degree contact, go get tested. And if you were exposed 2 days ago, get tested now, and then get tested 5 days from now. And in a period of 10 to 14 days, you would want everyone who was even close to any type of contact to be tested and to be repeat tested, and their contacts to be tested. And then you would have public service announcements out the kazoo that talks about people going home and contact tracing, and you would try to find some quarantine places. One of the things that that we looked at doing when I was dealing with tribal nations is we got tents. When people had conjugate housing in some of the tribal nation areas, you got tents. And when they couldn't go to conjugate housing, you dropped off a tent and caught in the yard, and you helped them, and you had a team set it up, and you let them, even if you needed to put 2 of them out there for the positives, you put those people outside. And then we even got creative, and we gave them a hotspot. So they could stay as sane and have some internet if they even had an internet connection. So we could do that. We have like 20,000 tents sitting in some stockpile somewhere. So that's the other thing you do. Then finally, reach out to the community. We've already been told our government can't help us, right? I know if we reached out to our community right now and we got volunteers from retired teachers, retired police officers, and other individuals, we could set up in every community that you're setting up those testing, you get volunteers and you set up the volunteer community organization contact tracing network. And you have contact tracing that happens simultaneously with your surge testing. And what you do is you go back to the days where the community helps itself when the government can't do anything for you. So that's how we treat COVID, is test, identify positives, isolate, quarantine, repeat, and educate. And that's what we do, and we continue to do that. The next step is masks. It's a respiratory droplet virus. Take some of that federal money that's been raining down on us and buy the right masks and get every resident in the state of Hawaii to be able to get a new mask or a couple new masks every week if necessary. Get the right size ones for the children, so we don't have this variation of all these masks that really don't do anything for you, because the number one thing that saves you from COVID is your mask. Okay. Number two, social distancing. You know, you can combine ventilation and social distancing. Yeah, I mean, there's all kind of variations, but if there's a single thing, it's your mask. And it's the quality of the mask with you trained how to wear it, and you wear that mask appropriately. And that's, I mean, I could go on. There's all kind of little fine nuances, but guys, that's really the answer that we need right now. And it's possible. None of this is impossible. I hear, oh, we don't have enough tests. Bullshit. We have tests.
That's the question, Doc. What's the testing capacity? What's the supplies wise? I cannot imagine that we don't have enough tests. As far as testing, you're the expert. That's what you do. You've tested for NCAA and you've tested for the Olympics. You've set up the protocols. And I see this question popping up quite a bit. Is there an issue with the supply of testing to provide adequate testing in the state of Hawaii right now?
Okay. No, and hell no. Okay. And every time I hear that, it makes me just like go back to the days of Sarah Park and Bruce Anderson. Well, we can't test because we don't have enough PPE, you know? And I'm a private doctor and I have a warehouse full of it. I mean, you know, no, I talked to diagnostics and clinical labs, and I just talked, we have PCR tests available. And then if they want to use good quality antigen tests, I could be getting 100,000 a week shipped in here or more. I could get more than that shipped in. And I'm not saying that, I'm guaranteeing that, because I'm doing that all over the country. I mean, I have people working all over the country. I have supply chains set up all over the country, and I know what the test availability are, right? So I don't believe that at all.
I mean, we know of all what we need to do, but testing, wouldn't you agree that testing is one of the most important things that we need to do right now to get us to know where we're at? To know exactly where we're at.
It has been from the beginning of this pandemic. We were shown the way by South Korea and Taiwan and Singapore. They were the front edge of this pandemic, and they took it and crushed it, and they showed us the model that worked. And so there's no doubt, I mean, your other option is, you do vis-a-vis, China, or where you say, okay, you are all not allowed to leave your house. And if you leave your house, you're going to be arrested. And everybody goes in their house. And yes, you could spread the disease in your house, but they know that if you stay in your house for 10 to 14 days and literally at the threat of being arrested, don't come out. I mean, that's how this disease stops. If we took every person and every person stayed solo for a period of 7 days or so, 10 days max, the disease would be gone from the islands. I mean, it's just simple physiology and simple virology, but obviously that's not the case. So, but anyways, it's got to be testing, and we have too many loose ends too. I was talking to Gina Mangieri. I communicate with all the news, all three channels, and she was just commenting about some of the things about all the people that had exemptions from our local residents, all the people that had exemptions from testing, both, essential workers, and then all the 30-some thousand people that came into the state after being on vacation as a local resident, and they didn't get tested, and they just basically went to quarantine, isolation. Come on, we all know how that goes, right? You come home, yeah, right, there's no enforcement, and so you're out there, just doing it. So anyways, that's we've got to tighten up those loopholes, to say the least.
Yep, I found out late. But Doc, let me ask you something that it just drives me batty. And maybe at our age, we're allowed to go batty every once in a while. But everything you've said and everything points to something so simple that can be done to start turning this thing around. Why do you think the government, or why do you think this administration doesn't want to rely on simpleness?
I quit thinking about trying to understand what they're doing or what they're thinking about. I just totally, it baffles me. It baffles me that the data is there right now. Everything's right there. We know that we're leading to deaths, and it's like we're wishing for something. I mean, I wish we could get that answer. I mean, we knew where we were going to be. I mean, I've been with you guys weekly now. We knew where we were going to be, and we predicted it happened. We knew where we were going to be. We predicted. A month ago, we knew we would be here. We predicted it happened. And you would think, wait, do we all have crystal balls, or we're all these, 2, 3, 4 people you guys bring in have this like, direct guide to heaven? No, it's science, it's data. I mean, it's just study the world. We know where we are right now. We have a pretty good idea where we're going to be 2 or 3 months from now. We have a pretty good idea where things are going to happen in different countries. We're watching it spread up through different parts of countries that have not had the disease. Now we're watching, I mean, like even a place like Oregon, just today, mandatory outdoor mask mandate because they are soaring up in Oregon, right? I was on CNN and they asked me about the Sturgis motorcycle rally. And I knew that they prepped me that they were going to ask me about that. And I said, well, ultimately, you're going to have probably at least 5 to plus times the number of people infected there in that area. And we're going to have death. And we're going to have that many people dying. So there she is, Dr. Akiona.
Hi.
Yeah, last week when you were on, when you left, you popped out and she popped in, and so we carried on the conversation with her for another 3.5 hours.
I know that, and she is just so wonderful and dynamic, and she's better looking than me, and she is so passionate, and she's over in the heart, on the ground, on the Big Island, and just provides just a perspective of really what is the worst island right now is the Big Island. The data of what we're dealing with and the percent positivity and everything that's happening on the Big Island makes it just it's everything wrong, because it's affecting Dr. Akiona is so passionate. She's 50% Native Hawaiian, right? Kohi? Yeah, she's half Native Hawaiian. She's been Native Hawaiian scholar, and it really cares. It's in her, truly in her blood, and it's so frustrating for someone like her to watch the disparities that occur, that we're letting more people die, more people be hospitalized, more people are not vaccinated. And it's just not by choice. There's so much more. That's why I was pinging her to come, because there's so much more than people are not choosing to be vaccinated. We only hear our leaders go, well, it's their fault. Those people, look, these people, this percentage, it's their fault because they're choosing not to get vaccinated. No, there's a hell of a lot more for people not getting vaccinated. And she can tell you more, from education to language to internet access to fear to past history of things that them and their families and their ancestors have had to endure, that we owe it to be more we owe it to these people all over the state. I don't care who you are, if you're, crazy anti-vaxxers, to try to convince them. So I'm sorry, Dr.
No,
Akiona, let me.
what I failed to do last week was actually introduce Dr. Akiona. So maybe you want to spend a moment, Doc, just to share with our viewers who you are and what.
Yeah, I'm going to be power.
We didn't just find somebody off the street and bring them on, but if you can just share with our viewers who you are, where you're from, and what are you doing.
Yeah. Hi, my name is Simon Dang, Ko'ohimanu Dang. I was born on Oahu. I was raised like Haleiwa, Wahiwa area. My grandpa, lots of people know my grandpa. My papa was Sonny Ramos. He was a police officer and the guy who knocked out Captain Haleiwa for knocking his sunglasses off his head. My great grandma is still alive. She just turned 96, I think, this year. She's a full-blood Hawaiian from Hana Maui, and she's still pretty punchy. And so that's my Hawaiian side. But my mom and dad were high school sweethearts and they had me. So they're fairly young. They believed that their baby was switched at birth and that I was somebody else's kid because they raised me. I was raised by lots of uncles and aunties. And my grandma died young. So she got colon cancer at 47 and they gave her 5 months to live. And she died in the home with just kind of not. It wasn't a great experience. All of us were young. And so that kind of was the beginning of our kind of our relationship with medicine. So I went to university. I went to Kamehameha, University of Hawaii Manoa. I was a researcher before I went to medicine and did a bunch of bench science research. So quercetins, like plant compounds, did a bunch of research papers. And then I got pulled into by Native Hawaiian Health. They actually asked me to take over a project that they were trying to get a doctor to do, but of course the pay was too ridiculously low, but put together a curriculum. So I trained community health workers to be patient navigators in 2004, 2005. And in order to do that, I had to do a needs assessment. So I did the statewide needs assessment. How do patients move through the care continuum, specifically with cancer care? And so actually, I could tell you all about how it's gotten worse, like progressively worse since 2004 and 2005. So I trained people on every single island, so Lanai included, and they were supposed to help people navigate the care continuum. And because there's this theory that Hawaiians were not good at being patients, but it wasn't. I think the question was wrong. The system was stacked against, especially the rural and outer island Native Hawaiians, Pacific Islanders, and Filipinos. So I went to medical school late. I mean, I was like 28, 29. I went to University of Pittsburgh, which is kind of where Doc grew up. I graduated out there. I spent an extra year out there and then came back to Hilo, did my residency, was a chief resident here, did faculty stuff here, had my daughter actually in Pittsburgh. So I do have an 11-year-old. She's over in Oahu right now at KS Kapalama. She's hanging out with her dad in Waianae. I give them lectures every day about whether or not they're being careful because they're super scared that she's going to get sick after all this time that we fought to keep her safe. But I live in Hilo. I'm still on the Big Island. My parents are on Oahu. Everybody else on Oahu. My baby sister is in Anahola with you guys on Kauai. So we covered the whole island chain. And I'm a pain in the butt on the Big Island because it's just not. The disparities are crazy. And then, in some cases, I'm fighting my own people because we've officially adopted some of like the worst beliefs. So like, that the Hawaiians who are anti-vax right now, it's hard because I told them like, I will fight for their right to make the same dumb decisions as everybody else, but only after they get fair and balanced education. So I'm like, it's okay you're allowed to make dumb decisions, but you got to listen to you have to get educated first. And so that's kind of what we've been doing. It's just getting harder, more painful because I still see with my colleagues in the hospital, we're parsing out care at this point and it's not fun. So that's a quick.
I want to try to squeeze in some questions as they come in. Yeah. One of the questions before you popped in was whether or not you need a requisition to get tested. I know on Kauai, They have the standalone every day at the convention hall, free testing, no note needed, none of that stuff. You just walk in, and I just did my test before I flew up to Oregon. And they have testing all over the island. And they have mobile vans, and I did see on Oahu, Honolulu City Council did a resolution. I watched that council meeting the other day, and they were kind of pissed off with the administration and did a resolution to increase testing. And I see Honolulu reopen the airport testing. But statewide, is there an issue with people getting tested as far as not needing a doctor's requisition or a doctor's note or any kind of?
That was one of
every
the
island have free testing that
yes.
no.
Well, no, and I think that was one of the first things we were arguing about before was it was this myth that you could just easily just get tested. So before it was, oh no, it's okay. It's super easy. Just go to the hospitals or wherever. But then the catch later you would find out is you need a requisition. Oh, just call your PCP. And like I would tell them 80% of people can't get in touch with their PCP or don't have one. So the any place that at this point is requiring a requisition from a PCP is relying on is like living in the yesteryear when a lot of us had PCPs. It's actually one more barrier to the problem. But then on the flip side of that, oftentimes the ones that we're getting free access to are not exactly helpful. So I don't know, Doc, what do you have to say about the access point?
Well, I mean, as a generality, again, I'll go back to the data, and we just hit up to mid to high 8,000 tests in a day. And, we can look at the science of the number of tests in conjunction with the positivity. And the bottom line is it's dismal. We barely were, in some days, like 2 days ago, we were at 5,000. We need to be at 20,000. There's data that you calculate based on the positivity, based on how much disease and your population, et cetera, that shows how many tests that need to be done every single day to start getting enough tests into the population to make a determination of how much disease is present. That's why we could tell you with a surety right now, there's got to be probably 1,500 to 2,000 positives, at least. And that's probably conservative right now in the state of Hawaii. That's how many people are out there positive, because we just have not had access to enough testing, and there's not enough access. And that goes along the lines with other things we're saying, that you got to take the testing to them. So Dr. Akiona, tell them about what we are doing with, you get your puppy, your dog.
He's been bugging me. Sorry.
Yeah, that's okay. He's a good boy. But tell these guys in the list, the viewers, what programs you have put together and how we're approaching on the Big Island. I mean, I'm just so proud of what you guys are doing.
It's a compare contrast to like a year ago. That's like, a year ago we were in all the different moku. We had kind of regular support with the county, and they really did understand that you needed to give access to all of the rural communities, and they cut that back pretty severely. And so right now, we kept these rural routes. We have access points Puna is a big area. Down south, there's Pahala, Naalehu, and Miloli'i, and there's a lot of people out there. And so all those people are having to drive up to Hilo or up to Kona, and then they give them like 4 hours on a Saturday. And essentially people start lining up at 6 o'clock, which means that they shut the gates by 10:30. So what we're telling them is, it's one thing to contract with people and say that there's more tests available, but you actually have to go to them. So we actually have to drive to Honoka'a. So we have the Monday route, the Honoka'a, North Kohala, and Waikoloa, and Kauai area. And then Tuesday, Upper Puna, Lower Puna, and Kia'au area. And then Kona side, we have Northern Kona, Southern Kona. We have to go back and forth again and again because it's just parts of Southern Kona. It's like Honau now doesn't necessarily want to drive down to Keauhou. And you have to actually pay attention to that, because then what's happening is we're missing some of the clusters. And then the entire time we were telling them, you have to keep your eyes on the shelters. So every Wednesday we're still doing East Hawaii shelters, West Hawaii shelters. And then, anytime that there's any suspicion or anything worrisome at the prisons, we're monitoring the university. So all of the housing or public housing around the university, just kind of constantly just giving them access to testing. And then just educating them, blanketing.
So guys, let me highlight Dr. Akiona, is our medical director over there, is leading this with a team of people. Zero support from the county, zero support from any authority. We are on our own taking the testing to these rural communities. And you guys have had the good Yoda governor or Mayor Harry on, and he saw how important it was, and he helped set us up, and we had guard, and we had support, and we were working in conjunction with the communities, and you saw what the results were. We had 2 and 3 and 4 cases because we had such broad scale testing. And then we call it strike teams. This is another thing when you ask me about the statewide process, about what needs to be done. You have to have strike teams available. And the minute you see outbreaks in areas that are of any kind of risk, within 8 to maximum probably 18 hours, you got to take a team in, you got to test, you got to do first degree and second degree contacts. And that's what we're trying to do now with these at-risk communities, but we get no support. I mean, I was over there last week, and we have people that are working 12, 14, 16 hours and zero support. And we're hiring. I think we just hired 8 new people we just brought on, and we just keep expanding and hiring. But and then multiply that by Oahu. We're not doing any of that here. You have a airport, and you have another test here, and I heard they are getting some stuff out with Waianae Coast out in Waianae, but otherwise you put these things and then you make people drive to them. And another thing, that she needs to have a crown on her head, because she should be made a queen with the type of work that she's done, but we're also taking vaccines out there. So we basically then, at the same time, you can go in this line and get vaccinated, and this line you're getting tested. And if you look at our vaccine numbers for the people at risk in the minority populations, we're blowing it through the ceiling. I mean, we're getting, sometimes that we'll do 100 vaccines in some of these rural communities, because guess what? They trust us, because we've created relationships within that community, because we go back again and again and again. No questions asked. They have a doctor there, or a physician assistant, or a nurse practitioner. We put medical staff on site. We don't, no blow to the Roberts people, but that's a testing process. No, this is a medical process. COVID is a medical event. It's a medical pandemic. And so when you can have someone that you can talk to and answer your questions or make determinations, it really makes a big difference, which is something that's massively missing in our process. So.
And I see stuff like Hanabata, and that gets printed in the paper, and that cracks people up. Yeah. I said, cool. Hamajang is next. So no worries. But I mean, that's the reality is what we do is we just try to make it as take away all the barriers. And so then there really isn't much left that they can say no to, because we're willing to bring everything to them. So a lot of the communities, they just want to be heard. So, and we just hang out with them with the Tita crew, and it works.
I saw on the CNN interview this morning with Lieutenant Governor, he rightfully said that we had 120%, we're at 120% capacity. Our hospitals are at 120% capacity, yep. Which is true. And he also said that Hawaii is still the safest place on earth. Well, it's not safe when you're at 120%. You see, visitors get hurt, they get sick, non-COVID related. And if I'm at a location that the hospitals are at 120%, I don't want to go there. I don't want to go there. It's not safe, because if you get hurt or you get into a car accident, God forbid, a heart attack, whatever, it's not safe. And that's why, again, the governor came out and said he asked the airlines. He were in negotiations with the airlines, and he asked them to please help. And the very next day, I got emails from 3 airlines the very next day that had ridiculously low fares, ridiculously low. So apparently the communication between the state and the airlines, either the governor isn't negotiating hard enough and not convincing them enough, or the airlines are just saying, screw it, we're going to continue to roll. We're going to do whatever we can because we know a lockdown is imminent. We know travel restrictions are imminent. So let's load them up, which is really not very bright because you're accelerating the time that it's going to take to get to the lockdown. And then they know they're going to have problems filling their seats. So I think those mixed messages, I think, is what's causing a lot of problems. It was interesting. I had to go to Best Buy today to go buy this ring light that I'm using because I obviously I don't pack my ring light when I travel. And the lady at the I ordered online. I did a pickup, so I didn't have to go around the store. I'm just so freaking paranoid. But I went to the pickup counter, and the lady, they're all masked up, and she saw my license, my ID, and she said, "Oh, Hawaii. I was planning to go there, but I changed my mind because of the COVID." I said, "Good. Tell all your friends. Don't come to Hawaii. COVID's rampant over there." So in some cases, the message is getting out, but it's not because of the airlines. It's definitely not because of the state. It's word of mouth.
A lot of people have been kind of commenting on the mixed messages, and I can tell you as a doc, I mean, in primary care especially, like we know what I know how I word a question kind of can change. It can make somebody dig their heels in, or it can, open them up to listening to me. And part of it is that I feel like I'm kind of fighting always against my colleagues when they're saying something like, "Hey, we're all in this together," and then like the very next day they say, "You're punishing some for the actions of a few," and then it's just I'm like, "Oh, okay, so are we in this together? Or are we not? And are we safe or are we not?" Because I know they don't want to panic people, but I mean, I know that there are people stuck at our hospital. They needed to go to Oahu. They needed to get stuff opened up because they had a stroke, and we can't do that because we have no beds. And I see the toll it's taking on my friends who are taking care of people who have to kind of let people in leukemic blast crisis where they need the help. They're gonna die, and you're just not able to do very much. And then you have to explain this to families, right? And it has nothing to do with COVID in their case, but it does. It has everything to do with COVID. And then, in the back of their minds, you can see like they know, like we do, that it's preventable. And so they're saying, I'm having to have these conversations that I shouldn't have to have. And we're in Hawaii, and, in the Big Island and Kauai, we already knew that healthcare was already kind of on the edge. So it's kind of, we can't look away. And I think that's the hard part for a lot of us. It's just, every day, like, what are we doing?
Guys, I want to say something. I know we're going to run out of some time. I can stay, and that's one thing. We don't sleep. I know Dr. Akiona doesn't sleep. I don't sleep. It's like I start my day at 3:30 every morning on the other side of the coast when I'm on the phone and things. But I came up with this idea today as I'm doing, sometimes I'll get my quiet time after coffee and do my tons and tons of research and communicate with colleagues all over. But one of the things that came out yesterday was a leak that the FDA and CDC are going to approve to have vaccines given now at 6 months for the booster versus waiting to 8 months, right? And there's data to support that. There's a lot of really solid data that came out of Israel. We have some data points that are pretty solid coming out of the United States, but we're trying to look at the fact that Delta is a game changer. We've said this again and again. And now we're seeing that, starting at about 6 months, the breakthrough of Delta infections is quite significant. Some data could show you're getting 60% effectiveness. Now, again, I want to highlight, please, everybody get vaccinated because you don't die, and your chances of being on a ventilator is like really, 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 really low. It saves your life. It will slow this down. But the fact is that we are seeing more and more hospitalizations. Our data is what, 10% here, and there are other areas across the country and world that are seeing higher percentages of their hospitalizations are actually vaccinated people with the breakthrough, right? So one of the things this is what bold leadership would do. I want our leadership to come out and give a shot in the arm to our healthcare workers. And I mean it by, let's start the 6-month vaccination process today, not waiting until September or October. These poor people are on the front lines exposing themselves. And Dr. Akiona and I will tell you in a heartbeat, we know so many medical colleagues that are breaking out positive in the hospitals and clinics and places like that, all over the state. You don't hear about it. You don't talk about it. But our colleagues are out there sacrificing on the front lines, and they're becoming positive. Let's be bold, and let's get these individuals vaccinated with their 3rd booster shot. And then second, you heard it today, headline on the news, Aloha Nursing Home over here in Kaneohe. Well, you want to know another secret? I've got at least 8 nursing homes where we're going to because of positives. They don't make the news, but I have teams that are going there. It's everywhere. So let's get our kapuna. Let's get the nursing homes, the nursing home staff, and begin getting the individuals that are, 65 or older. Let's get them their boosters. Let's be leaders in the state instead of sitting back and waiting. And let's show some support to our healthcare workers. So I'd like to push that right into the front of our leadership to be bold, because that's another thing we could do to slow down infection, is accelerate the boosters. So, Dr. Akiona, what do you think?
Trying to get you guys some vaccines on Oahu.
So, yeah. But that's
Is there
another
a shortage? Is there a shortage of vaccines?
no.
Well, no, but we're just waiting for, I think, the Janssen right now, but that's a statewide thing. We rely on the orders, and then we on the Big Island, we just kind of coordinate with the hospitals and the DOH.
Yeah. In general, we're well stocked when it comes to Pfizer and 1 with Pfizer, 2 with Moderna, but J&J, can come in and out, but we're well stocked to get everybody as many shots as we need to as we move forward. And boosters are going to be an important thing to do right now, and they will be, likely will be in the future too. So.
Charlie.
Well, I think, like from my position, when we deal with people who are positive, we sort of face them when they don't want to cooperate with us. And I mean, to the point that gets a little push and shove here and there. So I don't know if you folks face that in the hospital, but we face that on a day-to-day basis. So we've got a different type of, I don't want to call it an animal, but we have a different type of situation that we deal with. So then, my personnel has to make the decision whether or not at that point we arrest the person or not. And yet we know that if we put them inside, it's only going to make matters worse inside the jails. So, we kind of stuck all the way around. I'm sort of like one of those that says, well, he came on this flight, he can go right back, go get tested, or, or quarantine back home. You don't, right now, this is not a place to be. So that's why I'm sort of like quiet tonight, because I'm listening to you folks on how you're handling all of this. And I appreciate that. But yeah, there's so many different facets on when you run across people who are positive, when were they going to tell us that they were positive? And it gets hard. It gets hard because a lot of the arguments that I hear has always been, when we talk about the travelers, there's that point where we call the airports, right? That's where everything starts, right in that little area. And I had to ask, the Department of Health, what is the protocol? What is the protocol? I know we have contracted service that does the screening, but guess what, folks? Not all of them themselves know what the protocol is. And that's
I don't
where,
know, you guys remember that we started the airports, yeah? So I mean, we had a crash course when Harry gave us 72 hours to stand up both sides.
right,
So you know what that was like, because I mean, we literally, and we had to remember that the DOH was supposed to be the ultimate authority. And I mean, I had so much great gratitude for civil defense. I mean, on our side, it was Josh Black and it was Bill Hansen for me in the Hilo side. And so, like the buck stopped with them. So, as the medical provider, I would tell them like, this is what I would do. But ultimately, Josh would have to go and deal with these people who are just upset because we're ruining their vacation. So if you can appreciate, we also had to deal with that because, we weren't, it's not like we were professional at airport anything, but we had to set up the post-arrival testing in 3 days in October a year ago. So that started off with us, and it was a pretty steep learning curve. And that's not our classic. That's not where we wanted to be, but we understood that was one of the key points to keeping us safe, because there was no way of saying that we couldn't open, but at least we could have some control over what was coming through, and we had some control over the type of test that was being done. We could contribute our expertise to how it was interpreted and what the follow-up had to be. But, we were at the mercy of the Department of Health. And then ultimately the civil defense had to kind of come down hard on either side. But we had a lot of swearing and angry people. And I think we've had people throw stuff at us because we were ruining their vacation. We were telling them essentially, you guys are getting isolated, the threats and stuff like that. So, but we had at the time we had a really good relationship with civil defense, so we could commiserate together. We didn't have to take all of the anger. We could talk about it and debrief. We wouldn't have as much PTSD, but it was pretty harsh.
the thing that I'm still kind of in amazement is back then, the numbers weren't soaring like it is now. And just that balancing act.
It was crazy in Kona. Do you remember? I mean, we would be, up from 6, and the last flight was after 1. I mean, like 12:45. The numbers were crazy on our side.
No, the cases though. I think Charlie's talking about the cases, the actual cases. I think that's what a lot of us lay people are struggling with, is because, it seems like we're so hesitant now to do anything, especially regarding the visitors or the travelers, that, rewind a year and it was, my God, you just had a little jump and whoop, shut the thing down. And, you guys were the pioneers in testings. By now we should know all of that stuff. And I keep saying the book, many people have said this, the books have been written. We just got to read the book.
Yeah. And
Oh, go ahead. I just want to hit some of my questions because I know.
Go ahead. Go to the questions.
Sorry.
The vaccine, the booster, you mentioned is, possibly going to be 6 months. Scotty's asking, can we take too much vaccine? Is there a problem if we take too much? Is this something that we're going to have to take every 6 months until this pandemic is gone? And it could be 2 years, could be 3 years. Is that something that you foresee?
No, the answer is no. If people really knew the science about how those vaccines worked, it's just like that vaccine goes in there and it with that messenger RNA, and it creates this ability to have this little pseudo protein from the spike produced, and then it's gone, and then it just kind of fades away and goes away. People have this feeling like the vaccine itself is like in your body. That vaccine is in and out of your system and so quickly, and it just creates enough of this little signal to say, hey, immune system, see this little spiky thing here? Can you guys take a picture of this? And if you see it, go get it, and it's gone. So you're not going to get too much, because then what happens is if you get too much, if you get vaccine and you don't really need it, it's not going to do that much. It's not going to do anything bad to you. It's not going to, make you grow horns or anything like that. Okay, prediction, and I've been pretty good with predictions. We're not done. This booster will not be the last booster, and the likelihood as we move forward with the variants developing, as we're seeing with this one, it's kind of busting a little bit into the vaccine. We'll probably have enough variant change that we might have to have a booster have a little bit of actual true change in it to identify that maybe the spike will be developing a barb or something on it. I'm just making that up, but there'll be a little modification in it to be modifying as the variant modifies. So that's one option. Now, what we do not want to see is a true mutation. And a true mutation, not to get into the science side of it, but you got the big round thing and you got the spikes. Now, if the actual protein matrix and lattice that's underneath holding the big ball together starts changing enough, then all the testing we're doing and all these things in the PCRs are all going to have to be adapting to change to the whole big structure, kind of, changing its basic structure. So, we don't want to see that. And most of the science is showing that there's less likelihood that that's going to happen because there's not a lot of reason for it to do it. This virus has found that if it just keeps changing the adhesion of the spike and the strength of the spike and then replicate the numbers, life is good. It can infect the planet. So, but I'd say at least 2 to 3 years potentially. And I think, a lot of us think too that there could be even beyond that, where we're going to just get this mixed in with our flu shot. You'll get a flu shot, COVID shot, and it will go to an annual shot in the fall. That's a possibility.
Lambda. All the talk now about Lambda, and there'll be one after that, and there'll be one after that. Are you confident that these vaccines will be adjusted as well in time? Because it's clear that this state is not going to set up the safety net at our borders, which are the airports and the harbors. It's not going to happen right now. I mean, it's very clear because they haven't done it yet. And by setting up the perimeter, I'm talking about the testing, the pre and post testing. Apparently, it's not going to happen. So we can assume that Lambda will be here. It's already in the continent, like Delta. It's going to show up. And now we're hearing a lot of talk from experts as well that are saying that these Lambda variants may be resistant to the vaccines, the current vaccines.
Right. And the answer is it's still to be determined at this point. There still has to be more broad scale data being developed for a broad enough population. And what really sucks is how, because it came up through South America. And so versus, when we had, our current threat, India, across Europe, UK, great healthcare, and Delta, we had a lot of data, and that's why this was easy to predict. So since this was pushing up through South America, then we still need more data to get it. And unfortunately, what sucks is we're going to get it out of our own population, Americans. I know Florida's getting more of it, Texas is getting more of it. That's where we're going to get good data to study it. So it's hard for me to believe it's going to be anything worse than Delta. It's hard for me to believe.
Well, and I think that the problem is the bigger issue being kind of, that we're in it together thing is like the Lambda and eventually going on to Kappa and everything else is going to be because unless we can help vaccinate the world, there's always going to be some weak pockets, and so this is a disease that just kind of takes advantage of the weakest links, and it finds the weak spots. And so if we're not able to kind of share our vaccines and get everybody else protected, it'll find the weaknesses, mutate there. And because we're such a connected world with travel, and Hawaii being one of the really big time crossing points for a lot of business people, it's always going to be finding its way to our shores. And I think that that's the issue, kind of, on our macro scale, just being the health disparities, and kind of how unfortunately just disadvantaged, a lot of the third world countries are. And so, it is a first world problem to be able to be in a hospital on a ventilator after having declined the vaccine more than once, because in a lot of the countries, they haven't even been offered it one time. So I think, it's always kind of keeping that in perspective, that we can turn down the vaccines here, but in the places where they're not even getting the vaccines, it is mutating, and it will affect our health care and kind of the trajectory of all of the people who made the right decisions and got vaccinated anyways.
Oh, Charlie, any questions? I mean, we're at 8:15 already. I know, I appreciate you guys. We can stay all night long and talk, but I want to respect your time as well.
We always.
I know we got a ton of questions. We just got to set up a Q&A. I think we got to set up a separate night just for Q&A, and just we'll take questions and then let you guys answer them. I will say, to your point regarding the global vaccination issue, Dr. Jerome Kim made that very clear in his statements across the world in different professional venues. And by the way, he will be on our show next week. Unfortunately, his aunt passed away, who lives in Honolulu. So he's coming home for the services, and he will be on our show next week.
Yeah.
And we'll get a much better picture, I think, clearer picture of vaccinations and the world and what's happening in the world. That'll be interesting. Charlie, any questions you have, Charlie?
No, I just think that when we have these discussions, we sort of pique the interest. We have a little something for everyone to kind of dabble with. Because I think if we come with this preconceived notion that we're going to attack something this way, we might miss the whole picture in in other ways. So I kind of like what's happening, because especially when I have a fellow alumnus on the show with us tonight from the hills of Kapalama, it does make a difference, I have to admit.
Well, the echo of our song.
Yeah. Ray.
They're ganging up on us, Doc.
No.
We cannot even go to Kamehameha. We cannot even attempt to. I went Kamehameha once for a wedding. It's beautiful too. The chapel is gorgeous. Co-op everywhere. Co-op. Oh my God.
I almost ended up. I mean, I'm so thankful my grandchildren go there. But I don't know if you've ever been to the lower campus, also known as Farrington. That's an option.
That's good. Well, I can't tell you right now. I have, I think it's 4 to 5 people up on that campus every day testing. So my team is up there helping keep the campus safe. So we're helping, contributing, and I mean, our group is just. I'm so proud of them. They're all over the island. We're just so many different places. We're getting called by so many different business, so many different organizations, and we're the strike teams for all the nursing homes over here. And again, all of that's separate from any government support. It's just basically people call us to go help them. And now we're working with the hotels, right? Dr. Akiona on the Big Island, we're working with hotels here. We're going to be doing the Nahokus, the people coming in and helping test all the people before they go in for that, to keep them safe, because damn, we need music. We need our Hawaiian music to keep everybody happy and sane. And that's a tradition that deserves to happen. And it just goes, I mean, we're everywhere, but that's what you have to do. I mean, people call me, and my wife tells me, and my staff knows, and that's why Dr. Akiona is just, I keep telling her, when I can't do this anymore with the spirit she has, I'm trying to groom her to take over for what I do, but I have this problem, and there's only one word in my vocabulary when it comes to this, and it's yes. I never say no. I'll always find a way to to do it, whatever it takes. And one of my mantras when I have our massive group meetings, and too, it started way back in March last year, was, listen, failure is not an option. It's not an option. This is our home. This is our family. These are our children. These are our friends, our relatives, and someone's going to have to stand up for them. And then failure is not an option. And I just have great people that have rallied around us. So.
Well, as you know, we appreciate all that you have done from day one with the testing. I mean, and we still got a lot of work to do. I mean, OCCC, the prison systems ripping up again, airlines. I mean, this thing is not going away anytime soon. And the more and more we play around with it and test the strength of this virus, we're going to lose if we don't change our behaviors. And when I say change our behaviors, I mean, not just individually. I don't have my personal lockdown sign that I have back home, but if we don't change our behaviors, this thing is not going to go away. And that includes our leadership. That includes our leadership. And, we just got to keep on doing what we got to do. That's just how it works. And we are in this together. But, when we say we're in this together, we all got to be in it together. We cannot make exceptions to the rules. We cannot. There's a video going around with the lieutenant governor at some function in a restaurant with no masks, hugging, and I know you all saw it. And it's the big elephant in the room. I don't care. I'm just going to call it as I see it. And that's what causes problems when we as lay people are trying our best. And when you see that going on, and it's hard not to ignore it, because it's so clear that that's the kind of behavior that creates spread. And we all gotta do what we gotta do. Everybody, I don't care who you are. And I hope that kinds of stuff stops happening. Because again, those little things, it's what can happen out of a situation like that. A cluster that can happen from there. You're talking a lot of cases. And we know it's happening. We know it's happening in private homes and bars and restaurants, and that all has to stop. And if the government doesn't have the grapes to say, hey, we're going to clamp it down, then it's going to be very difficult for us to get a handle of this virus. That's just the way it is. Because you be nice about it and trust people and worry about the economy. I understand, but it's one of two things. Are you going to do it? Like you say, right? You're in it to win it. You're always in it to win it. You're not in it to make and show like you're winning. No, you got to really do it. And if you're not going to do them, then we're not going to win. And people are going to get sick and people are going to die. That's just an unfortunate reality of this thing. Anyway, I had to vent. I've seen enough comments come up on that issue. I didn't want to ignore it because it is real and it's all over the place. And it's just behaviors, all of us, whether you're the governor or you're unemployed, doesn't matter. We all gotta do what we gotta do. That's I know I'm shocked the crap out of everybody, but that's it. I'm sorry. But when you do things like that, then you better expect. I was a political figure for many years. Trust me, if I farted in public, everyone knew about it. That's what happens when you're in that position. So if you're in that position, don't do anything stupid because you're going to get called out. That's just how it works. So, anyway.
Mellor, can I say one thing that you make me always want to remind that I want to start hearing more? I'm tired of all the finger pointing that this is all about the people that are not vaccinated, right? Mm-hmm. Sure, we know they made that decision. We 1,000%. Dr. Akiona and I and my team are out there vaccinating, and we're just encouraging it. But we are one state, and we are one people of one state, and we're all in this together. And we don't need to be separating us. I don't care how, crazy the anti-vaxxers are or the other people all over the map. We are one people and we are one state, and we have to come together to create a solution and not divide us. We need to find ways to have common grounds where we help those maybe get educated. We help those people who are positive, who will then get vaccinated. But let's stop the rhetoric where we just keep, blaming all the people that haven't got vaccinated. And let's come together as a state. Let's find a way to get through this together. So.
Well said. I think that's what it's going to take, and it's going to take everybody doing what they need to do. Right. But I agree with you 100%. We state this almost every night on the show that we totally respect and love everybody, even if they chose not to get vaccinated. People have different reasons. Some people cannot, for religious reasons or medical reasons, and some just are not comfortable, and that's fine. And but the message from the state is, it's really blaming that segment of the community that have chosen not to get vaccinated. And I think that's wrong. I think that's creating more of a problem than acknowledging those that have chosen not to get a vaccine and working with those people to make sure that they are educated and informed to be safe. Right?
Yeah.
Exactly right. It's like condoms.
Mm-hmm.
Not everybody wants to wear them. So, how are you going to stop them from not wearing or using safety gear, precautions? You're not. And rather than vilify and create this division, no, let's accept it, acknowledge it, and let's work with them to be smart.
That's right. About
their decision. And if we provide enough, you said it earlier, Dr. Akiona, about educating them, and hopefully hear us out.
Yeah.
And then make your choice rather than hit up Google and Google, type in the search bar, why shouldn't I take the vaccine? Or COVID vaccine dangers. Are you scared of crap out of you? You ain't gonna take the vaccine, I promise you.
Yeah.
Without looking at the positives and the successes of the vaccine. So again, don't vilify, let's unify, and let's work with everybody and get everybody safely through this pandemic. That should be the mission statement of the state government right now, and the counties, is let's unify. And I think Mayor Kawakami tried to do that today. We're still going to encourage the benefits of the vaccine. I think we're still going to encourage people to get vaccinated. But for those of you that don't, we still love you, but we want you guys to be safe as well. You guys to be safe.
Yeah.
So I don't know. We lost Charlie. So.
No, we didn't lose. He's still on there. He's hiding, I think.
Oh, okay.
Well, his name's on there. So
there he is. There he is.
There he is. There he is. Yeah, he was doing something. Were you eating, Charlie? Because I know you're working hard, man.
Oh, so, it's always when I get these show, I get ton loads of calls. When you're responsible for the security of an airport, you're gonna get these calls at all times of night. And I just, unfortunately, something came across that I had to tend to right away.
It's okay. Yeah. I do this when I'm on all these Zooms, and one of the things we're trained as doctors is food is like a secondary event. You basically get it when you can. And so sometimes I'll go on and off in the Zoom, and I'll click my camera off, and I'll hurry up and reach over and eat a few bites and then turn my picture back on. And
Doc, when I eat, I leave ketchup on my mouth. You'll know I've been eating. Don't worry.
And Charlie doesn't turn the camera off to eat. Trust me, he'll whack them right on the screen.
I get dry aqua, I get whatever. I just eat them right on the air. Don't worry about that.
Yeah.
I want to apologize to the viewers because the comments don't stop. We probably have 1,000 comments. I cannot catch them all, and I apologize. But every so often, I see one, and I'm going to ask this last question, and please be brief because it's late. And I don't want to hold you guys up, but it says, doctor, this is a serious question. Please tell me what vaccine is safest for a person who has anaphylactic reactions to medications. I was told that J&J. That's the question. That's the question.
Would need more detail. I think the question would be what medications do they have the anaphylaxis to? You know, like for example, if they had a penicillin anaphylaxis, it's like big deal. So that's not going to be it. So I guess just like anything would be, but as a generality, I don't really know of any data that shows there's a tremendous difference. But again, I'm shooting kind of blind because I don't know what we're talking about, what kind of medication. Yeah. By and large, I guess here's the best answer I can say: you can get vaccinated. Okay. It'd be something you should check with your doctor on, find out about which meds you're allergic to, and then make an informed decision. But there is no one who should not get it due to prior allergy.
Yeah, there's very few contraindications. I mean, it was literally, I think the main one was a reaction to the actual shot itself. And so for the most part, I mean, even my allergy friends were saying, please don't. Like, if you can get vaccinated, get vaccinated. Right now, because time is of the essence, it depends. So on my transient kind of group, where I'm probably not going to be able to get to them ever again, the Johnson & Johnson, and I let them know that 2 weeks after we give you the shot, you're going to be protected, ideally. And then the next one for us lately, it's been Pfizer because it has the shortest window, because I give you a shot today, I come back in 3 weeks, and then 2 weeks after that, you're protected. So, and it's literally just because time is of the essence right now, because I'm telling them, like, you're still very vulnerable. So please don't behave like a dummy because I gave you one shot. You're not protected until 2 weeks after your second one. So you still got, you still got to protect yourself. So lately, people have been kind of leaning more towards Pfizer. Johnson & Johnson, especially for the people who are like, all right, fine, you talk me into it, I'll take that one shot. And most of them are not interested in a booster because they said, look, I said I only wanted one shot, leave me alone. So, but it's nice that we were able to at least negotiate a little bit and talk to them a little bit about the time frame and how long you're vulnerable for before you're fully protected.
I think we've always said, and I think every expert that's come on has said the same thing: check with your PCP. They know you best. They know your conditions. It's okay to get a second opinion if you disagree, but it's very hard for these our friends on the show to diagnose. But I can tell you personally, I have an allergy to penicillin. I also had a bad reaction to the hepatitis vaccine when I was in the police force. My doctor, my PCP said, wait. You guys, most of our viewers know this because we did this on the show. Wait, she wasn't comfortable yet. She wanted to see, this was early on, right? And when Johnson & Johnson came out, it wasn't because of Johnson & Johnson, but she said about the time Johnson & Johnson came out, she said that she had checked all the studies based on hepatitis reactions, and she suggested that I get the shot, but sit there for that extra 30 minutes after the shot to make sure. And I had absolutely no reaction whatsoever. So PCP knows best. PCP knows best.
Well, that's a good segue, and I know we're running over, but I want to make one more comment. There have been, I think, one of the big failures in our state right now, when we talk about start taking responsibility for not just saying, oh, you didn't get vaccinated. As you guys know, my group is across the country, and I'm working on numerous projects all over the place. And one of the things we failed to do, as you mentioned, PCP, other states are finding ways to get the vaccines into the hands of the PCPs so they can get them and be administering them in their offices to their patients, because who do you know the best? Who has the best chance? Is it your pharmacist that changes like 15 different times when you walk in there if you're going to one of the big box ones? Or is it your doctor you've been seeing for 20 or 30 years or who has carried you through thick and thin? We haven't made any attempt whatsoever in our state to get the doctors. The primary doctors in our state, remember, about 55% of our doctors are still solo practice or small practice 2s or 3s. They're dying. primary care docs are dying out there, just struggling with what's going on. And no one even mentions them or even talks to them about helping. And that's a great segue about where we should be right now. Where's the planning? Where's, we should be thinking what next year, what's going to happen. But one of the things right now, we should have a massive plan for how we're going to get these doses into the hands of our pediatricians, because our kids are going to be coming up. It's going to happen probably in November. We're going to have vaccines available, and we should be planning from the day those vaccines are available to not tell parents. Can you imagine tell a parent to take it to the pharmacist? Pharmacists don't know how to give shots to little babies. And I'm not knocking our pharmacists or things like that. We need to set our pediatricians up and our family doctors up to be the next big push of the vaccination drive to get them into our children, to protect our children. So if we had anybody listening out there, hello. So
yeah, I hope they listen, man. I gotta tell you, I hope they listen. I hope they do. They'll come on after we're done and watch and listen and get pissed off, and
yeah,
it is what it is.
yeah.
Anyway, 8:32, guys. We went long, and appreciate the two of you jumping on tonight. Really do. Charlie, any closing thoughts?
Well, I've always said I've had a lot of discussions this last week with friends, and I said, we're going to remain friends. You take your position, I'll take mine. But we all know that, like it was brought up earlier, when you Google something, all you're trying to do is validate your position, and you'll find the answer. But I always share this story. When my dad had open heart surgery, he was in pain. He never recovered from it. And the day he had the surgery, so 20 days later, he died. He stayed in the hospital. When I went through my surgery, I didn't know what the outcome was. All I know, I should have been afraid because I saw my dad went through. I'm a grandfather, I'm a father, a husband. I try anything to stay alive. That's why I went for it. The only regret, I got a big scar on my chest, but hey, I'm alive. I live another day. I tell my story. So there's going to be those out there that not going to buy off in what we said tonight. And it's okay. But when something happens, all I can say is please understand it's going to be a rough road for you. That's all I can say. But I'm pretty sure that, and we've said this before, and that's why I always try to stick to the point, is that we give you the information. You take the information and you do what you want to do with it. If it doesn't work this time, you want to wait for another episode, maybe what we deliver that time, then maybe you'll buy into it. Whenever that happens, it doesn't have to be right now. So I don't want anybody going away from the show tonight saying, they say they give us all this information, but it sounds like they're forcing it. No, we're not forcing it on you. We're just leaving it out there for you to decide for yourself. That's all we can do. But like Dr. Akiona said, we are racing against time. Dr. Miscovich said the same thing. We are racing against time. Time is of the essence. Okay? So I want to thank our two esteemed guests, as always. And yes, I am partial to Kamehameha, and I'm glad you keep going Kamehameha. And I give both of the doc and you, Mel, credit. You guys went to Ivy League schools. Yeah. Quite high and wherever you went, doc. But I just like to say thank you very, very much for coming on. And I know our guests appreciate it very much. There you go, Mel.
Charlie, hold on one second. Was that your wife that just walked by? Is that her telling you to get out of there? Because I don't know if you guys noticed, and Dr. Akiona, his shirt matches the plant over his shoulder. I was looking at him and saying, look at him, man. He's really looking good tonight, haircut and everything. And that shirt is matching your plant perfectly. So you're styling tonight.
Well, I just want you to know, I painted that picture.
Oh, jeez.
And I painted this shirt.
Sorry.
Thank you for the compliments there, Doc.
Stephanie doesn't realize that your mic is very sensitive and you can hear everything she says.
Whoa.
You know, early on in the show when we first started, one night where I forget he said something crazy about his wife and she conked him on the head with a frying pan right in front of everybody. It was classic.
That's why I tell everybody I get 1 year collection of walks, all shaped like my head. So it's okay.
Hey, doctors, thank you very much for sharing your time with us. Again, we
Thank you.
appreciate it very much. You know, Charlie, just in a real quick follow-up to what you said. You know, I'm here in Oregon, as many of you know, with my daughter who had COVID. 2 weeks, worst 2 weeks of her life. That's what she's, you know, now that we're here, she describes her experience, her journey. She wasn't vaccinated. She chose not to be vaccinated because she had listened to a lot of, in fact, all of her friends had been vaccinated. So it wasn't peer pressure. It was just her own personal due diligence that she did, and she didn't really believe that COVID was real. Well, guess what? She got zapped, and she's the worst thing that's ever. And this girl has been through back surgery. She's been through a lot of stuff, some nasty stuff. And this was worse than anything she's ever lived with. So we're here this week. She's getting her vaccine. But it took COVID. It took a horrific battle. No, she wasn't on the ventilator, but she was sick, very, very sick, and she was alone. But it took that experience for her to decide, you know, I'm going to get vaccinated. Please do not wait for that to happen to change your mind. Listen to the stories of those that you know or you may know, or of those that survived COVID, because it's really imperative that we consider the dangers of this thing, and it's so preventable. I think that's what's hard for us, and I can only imagine how difficult it is for doctors and nurses to treat patients, or even watch patients die when it could have been prevented. So tomorrow night we have Dr. Tim Brown from the East West Center. This guy's statistics, I gotta tell you, he pretty much called this thing, and he continues to call it. And if we listen to his numbers, if we don't change, it's going to be bad. And I mean, it's already bad. It's going to get worse. So please join us tomorrow night. Tomorrow night at 7 o'clock Hawaii time with Dr. Tim Brown. And then, of course, next week, Dr. Jerome Kim will be joining us to give us the global perspective of vaccinations, what's happening. So again, thank you all for staying with us tonight for this extended show. It's hard to quit when we got these two amazing doctors. So you guys all take care, stay safe, God bless. We'll see you all tomorrow night.
Aloha.
Aloha.